So the topic that I am going to cover today is from carbohydrates, and it is glycosaminoglycans. Okay, glycosaminoglycans or mucopolysaccharides. Okay, glycosaminoglycans, also known as mucopolysaccharides. That is what we are going to cover. So, as the name is saying, glycose amino. So it has glyco part as well. It has amino part as well. So it is combination of two things. One is glyco is for polysaccharides, or to be specific, heteropolysaccharide chains, and amino is for proteins. So it has two things, carbohydrates as well as proteins combined together to form glycosaminoglycans. All right. What is their function in our body? They support cellular and the fibrous components, and they mediate cell to cell signaling and adhesions. What are the names of or examples of glycosaminoglycans? So they are classified into this examples that we are seeing here. They are chondroitin sulfate, keratan sulfate, dermatan sulfate, hyaluronic acid, heparin, and heparan sulfate. These are all examples of glycosaminoglycans. So you can be asked in exam that heparin is an example of. So we all know it is working as anticoagulant, but what is its chemical structure? It is glycosaminoglycans. All right. Now it gets degraded by certain set of enzymes, that is lysosomal hydrolase. Now what it is exactly, what does it exactly mean is whatever things which are there in our body, they at some point of time it has to get degraded. So this is a structure within our body, it has to be degraded in different parts, and they have to be excreted out of the body, either through urinary pathway or through the stools. But for this degradation, certain enzymes work. Okay, certain enzymes take part in degradation of certain objects. Now, if we are talking about the glycosaminoglycans or mucopolysaccharides, in that case, these enzymes are lysosomal hydrolase. I hope you all are making notes. So the lysosomal hydrolase are the enzymes which are responsible for degradation of the glycosaminoglycans. But sometimes due to hereditary effect or genetic deformity, there can be defect in these enzymes which will prevent this degradation from taking place. Now, if this degradation is not taking place, that means the glycosaminoglycans are being formed in the body, but they are not being excreted. So their storage just hold on. Okay. So as I told you that this glycosaminoglycans and mucopolysaccharides, because they are not being excreted out of the body, more and more of them will get stored, and they'll be stored in different parts of the body. It could be central nervous system, it could be skeletal system, it could be eyes, anywhere, heart, liver, in all the viscera, it can get accumulated. When it gets accumulated, it leads to certain kind of defects. These disorders or these syndromes are known as, anyone, what are they called? They are known as mucopolysaccharidosis. Got it, everyone? Students?
Yes, sir.
Yes, sir.
Okay, this was like, after this we are going to discuss mucopolysaccharidosis, which are pathological conditions or disease associated with accumulation of mucopolysaccharides due to defective lysosomal hydrolase enzymes. Is it clear, everyone? Shall we move on to the classification?
Yes, sir. Yes, sir.
Okay, so let's see the classification of mucopolysaccharidosis. So, have you all heard these names during your preparation or during the UG time? Hurler disease, Hunter disease, the Marotex Lamy disease. All these names have you heard? It's okay if you don't know about what do they cause. Have you heard these names?
Yes, sir.
Yes, sir.
So, when we talk about this mucopolysaccharidosis, no? These are group of conditions which are all caused by accumulation of mucopolysaccharidosis. Now, we all know it is due to defective enzymes. Which enzymes are defective? The group of enzymes which are defective are, I just now told
Lysosomal
you,
Lysosomal hydrolase.
hydrolase.
lysosomal hydrolase enzyme. These enzymes are defective. But lysosomal hydrolase is not name of a single enzyme. Lysosomal hydrolase has multiple type of enzymes which fall under this group. Now, depending on which enzyme is defective, different type of clinical features are there, and depending on what clinical features are there, we have certain syndromes that we need to know. So there are total 6 types of mucopolysaccharidosis which are there. So if you see type, there are 6 types: 1, 2, 3, 4. Remember, type 5 is not there. Okay, so 1, 2, 3, 4, then 6, and then 7. There are 7 types of mucopolysaccharidosis. Okay, 6 types of them, but because number 5 is not there, up to total number 7 it is there. Now, how to remember all the names, which one is which? So for remembering, you can remember this. Well, it is very simple mnemonic that while preparing this lecture I thought of. If you have any other mucopolysaccharidosis mnemonic, you can remember based on that. So you can remember it as HHS MMS. Okay, so this is what I could thought of HSS MMS as a mnemonic. So type 1, type 2, type 3, type 4, type 6, and type 7. Type 5 is not there. Okay, now which one is which? So type 1 is Hurler, type 2 is Hunter, type 3. Type 3 you can so type 3 and type 7, both of them are on name S. So that you have to remember. Type 3 is San Filippo. Okay. Then type 4 and type 5, both of them are from name M. So type 4 is Morquio syndrome. Type 5 is Marotex Lamy syndrome. And type 6 is Sly syndrome. Okay, how to remember? If you can remember type 1 as Hurler, okay, the Hunter as T stands for 2, that way you can remember. So Hunter is type 2, type 3S is San Filippo, type 4S QU in its spelling. Q you can remember as quartile or quarter, which stands for 4. Okay, then other M is Marotex-Lamy syndrome, and type 7 is Sly syndrome. These are the syndromes which fall under mucopolysaccharidosis from type 1 till type 7. So this mnemonic is clear to all of you, students?
Yes. Yes.
Have you made notes of these names?
Yes. Yes.
Yes, sir.
Okay. Now, other thing that we need to remember about these types of syndrome is there are three things we'll need to remember. Sorry, two things. One, sorry, yes, we have to remember three things about each of the syndrome. We have remembered name, then we need to remember which enzymes defect causes this type of condition. So we need to know the enzymes, we'll need to know about the clinical conditions, and we'll need to know about which mucopolysaccharide is being accumulated in the body under this type of syndrome. So first we need to know which enzymes are being affected. So out of this six, we need to remember the names for five. The San Filippo, if you see the subtypes, San Filippo has four subtypes, A, B, C, and D. And all the four of them have different enzymes which are causing them, but we don't need to remember those enzymes. So that is fine. Type 4 has two subtypes, type A and type B. We'll remember both of them, and others have single. Acha. Type 1 syndrome, that is Hurler syndrome, is caused by the enzyme known as alpha L iduronidase. Okay. Now, depending on what type of defect is there, if whether this enzyme is completely absent. If this enzyme is completely absent, then it is type 1A, that is Hurler syndrome. There is another type which is type 1B, where this L-iduronidase is not completely absent, but it is defective uh, uh, in lesser quantity than it is required. That syndrome is Shy syndrome. Both of them, type 1A and type 1B, both of them are due to defect in alpha L iduronidase. Remember this name, iduronic acid. This is a carbohydrate, monosaccharide. So as we all know, mucopolysaccharide has a carbohydrate component within them as well. So for type 1 and type 2, for both of them, this name iduronic acid is there. For type 1, it is iduronidase, and for type 2, it is iduronate sulfatase. It might, like, we might feel difficulty in remembering the names, but if you read and then you revise, it will be easy for you. So if you remember this name of iduronic acid, based on that, first two you'll remember, iduronidase and iduronate sulfatase. So one more thing, because Hunter we remember T, for 2 we remember T, type 2 Hunter, TT. Same way, when the name sulfatase T is coming, that is also in type 2. So if we are able to remember based on iduronic acid, the one which is iduronidase is in type 1, and where iduronate sulfatase is there, it is type 2. You'll be able to remember this, everyone?
Yes.
Students?
Yes, sir.
Yes, sir.
Okay, then we have to remember four more. So say it is not necessary that you'll have to mug it up. Okay, these are the things that are some tricks that I'm telling you, know, because in exam we don't have to write any kind of we don't have to write any short note there. It all will be in front of us and we have to answer. Okay, so this small tricks you can remember in answer. Then comes type 4. Now type 4 has two types, A and B. Two different enzymes are causing same kind of disease or syndrome. Okay, so both of them are falling under Markio syndrome. Now there is type A and there is type B. The enzyme responsible for type A is N-acetyl galactosamine. Now number you have to remember. 6 sulfatase. N-acetyl galactosamine 6 sulfatase for type 4A, and for type 4B it is beta galactosidase. Now we'll be like how we are going to remember all these things in exam. So as I already told you, you don't have to remember you don't have to mug it up. There are certain tricks that are helping us in remembering the names. So this N-acetyl galactosamine 6 sulfatase we just now saw, which is for type 4. If you see for type 6, it is same N-acetyl galactosamine, but instead of 6 sulfatase, it is 4 sulfatase. So when we are talking about type 4, it is 6 sulfatase, and when we're talking about type 6, it is 4 sulfatase. So that reverse is there. So if at all in exam it is asked to us N-acetyl galactosamine 6 sulfatase or 4 sulfatase, you'll be able to remember 6 sulfatase is for type 4 and 4 sulfatase is for type 6. Got it, students?
Yes.
Yes.
Okay. And for SLY, it is beta. In type 4, we have galactosidase. Okay. But in type 7, it is beta glucuronidase. So it is also somewhat similar. Galactosidase and glucuronidase. Okay. So for type 4A and B, if you are able to, sort out, it is almost same for 6 and 7. See, remember, these are, I'm not telling you from biochemistry point of view. I'm telling you these things based on remembering point of view. How you can remember this for our exam. So the types and the enzymes are clear for all of you?
Yes, sir.
Yes, sir.
Everyone please answer so we can move forward.
Yes.
Yes, sir.
Yes.
So if you remember these things, most of the things that you had to remember or you had to, kind of mug up is clear. These things we know, these are the types of mucopolysaccharidosis, and these are the enzymes which are responsible or which are defective, which have caused this kind of condition. So these are types. Okay, one more thing that we need to remember is the inheritance. Of all this condition is autosomal recessive. Okay, except for one condition, which is MPS type 2 or Hunter syndrome, which is X-linked. Whenever it is X-linked, that means men will be affected more than female. Whereas in everything else, the chances of them being affected will be equal for both men and women. Okay, so only condition, only mucopolysaccharidosis, which is X-linked or X-linked mucopolysaccharidosis condition, if it is asked to us, it will be Hunter syndrome or Hunter's disease. Is it clear, everyone?
Yes, sir.
Yes.
Okay, so we have seen conditions or diseases. We have seen the names for them, their inheritance, and the enzyme defect. That also we have seen. Now we have to see urinary metabolite. Now, why urinary metabolite we are talking about? Because as I told you, this mucopolysaccharidosis, what is happening? That excess amount of mucopolysaccharides are being, accumulated in the body. And the patient has so and so conditions that we are going to see. Then what things you will find in that patient? That patient is excreting in the urine. That is known as mucopolysaccharide urea. That is, in urine, mucopolysaccharides are being excreted. Okay, which mucopolysaccharide is being excreted in which condition, that we'll need to remember. So for type 1 Hurler's condition or Shy's disease, it is dermatan sulfate and heparan sulfate. For both of them, dermatan sulfate, heparan sulfate is there. In type 2 also, dermatan sulfate and heparan sulfate is there, same. In type 3, as I told you, 4 types are there, A, B, and C, D. For them, heparan sulfate is there. So for type 1, it was DS and HS. For type 2, it is DS and HS. For type 3, it is HS. DS is dermatan sulfate and HS is heparan sulfate. Okay. Then type 4, type 4A, type 4B. For type 4A, it is keratan sulfate and chondroitin 6 sulfate. Whereas for type 4B, it is keratan sulfate. Okay. And then again, type 6 and type 7. For type 6, it is dermatan sulfate. Type 7, it is dermatan sulfate and heparan sulfate. So type 1, type 2, type 7 have both dermatan and heparan sulfate. Type 3 has just heparan sulfate. Type 6 has just dermatan sulfate. Okay. The only exception, if you see, that we feel can be asked to you is in which condition keratan sulfate is seen in urine, in which condition chondroitin 6 sulfate is 6 in urine. So those things falls under type 4. Is it clear, everyone?
Yes.
Yes, sir.
Yes.
Everyone, please let me know whether you are getting it. See,
Sure.
first of all, let me be very clear to you. Biochemistry is very dry subject, we can say. Very less things you can correlate with what you are doing in your clinical practice. All right, but try and make this small tricks which will help you remember the things. Okay, so these are the things which are being excreted in the form of urine. Now, based on that, we can have different type of clinical conditions. Okay, what clinical conditions? So clinical conditions can be asked to you in exam in the form of MCQ, that the patient came to you, he had so and so and so conditions. So how to remember so and so condition was there? So first of all, let's see the clinical features. So clinical features, no, you can remember, you don't have to remember in the form of short note, but the clinical features you can remember in the form of in which area the defect is there. Okay, so if you see the head and neck, so or just head, if you see, so mental deficiency, coarse facial features, and corneal clouding. This all comes under head. Okay, so mental deficiency, that is mental retardation. Coarse facial features, what comes under coarse facial features? There would be macroglossia, that means large tongue will be there, open mouth will be there, frontal bossing will be there. All these things come under coarse facial features. And corneal clouding, that means haziness over the cornea, that would be seen. That is corneal clouding. These are the upper body features. Then in the abdomen, what will you see? Visceromegaly. Visceromegaly will be including heart and liver. Okay, megaly means increase in size. When the size of liver, size of heart increasing, all these are falling under visceromegaly. Then skeletal features. Skeletal features mean in bone, and because of bone in the height, what all features we are seeing. So short stature, joint contracture, dysostosis multiplex. Short stature means decreased height. Dysostosis multiplex are different type of developmental abnormalities in the joints. These are all the skeletal conditions. And in investigations, leukocyte investigations, leukocyte inclusions and mucopolysacchariduria. Now this mucopolysacchariduria, I already told you that in this condition, mucopolysaccharides are being excreted in the form of urine. So if you see, the only feature which is consistent amongst all of them is mucopolysacchariduria. So that is not much of important because it is there in all of them, because all of them, the condition itself is based on this condition, based on this finding. Okay. Then leukocyte inclusions. Leukocyte inclusion means, as we know that this glycosaminoglycans are being accumulated in our body. This will also be present in different organs. So in leukocyte, if you see under microscope and if you see leukocyte within them, even in leukocytes, you will see presence of this mucopolysaccharides. Depending on this dermatan keratin, which kind of condition is there, dermatan sulfate, keratin sulfate, or whatever. When they are present in leukocyte, it is known as leukocyte inclusions. And the only condition amongst all of them where it doesn't have leukocyte inclusion is morchio. Morquio syndrome. Except for that, all of them have some what more or less leukocyte inclusions. Is it clear about these two investigations? So last thing cannot be asked to us. Mucopolysacchariduria, obviously it is there in all of them. Yeah, it can be asked to you that which type of mucopolysacchariduria is there, that you already saw here. In type 1 is DS, HS and so on. All of them we have seen. Leukocyte inclusion, you can be asked that in which condition we don't see leukocyte inclusion. Then what will be the answer? Which type of mucopolysaccharidosis does not show leukocyte inclusions?
Type 4.
Type 4 or Morquio. Okay. Then coming to the upper part of the body. In that, mental deficiency or mental retardation. So in type 1, in type 1H or type 1A, that is Hurler syndrome, it will have mental retardation. Hunter syndrome, type 2 will have mental retardation, and type 3, Sanfilippo, will have mental retardation. So 1, 2 and 3 have mental retardation. 4, 6 and 7 doesn't have mental retardation. That way you have to remember. Okay. Coarse facial features, that is, I told you what the coarse facial features are. 1 and 2 has the coarse facial features. 3 doesn't have, 4 doesn't have, 6 has, and 7 doesn't. So you see, you'll not need to remember all of these features in this much details. I'm just telling you what all things are there. And depending on one or two peculiar things, you'll be able to answer the questions which are asked to us. Okay. Corneal clouding. Corneal clouding is seen in type 1, but it is not seen in type 2, type 3. Then it is seen in type 4 and in type 6. Type 7 may or may not have. So type 2 and type 3 are the conditions where you will not see corneal clouding. So if it is given to you, a question is given to you where, let's say, option from 1 till 4 is given, or 1, 2, 3 and 4 is given. There, if the mention of corneal clouding is there, automatically type 2 and type 3 will be excluded. And then based on other features like mental deficiency, which is there in type 1, but it is not there in type 4, you'll be able to choose the answer. Are you getting what I am telling you here, students?
Yes, sir.
Yes,
Okay.
yes.
So these are the features you need to remember, because for us, main it is the investigation and the upper body features. Based on what you'll be able to answer this. The only condition which doesn't have visceromegaly is type 4. Although here type 3 has mentioned visceromegaly as negative, but it does have cardiac involvement. So the only condition which does not have visceromegaly, it will be type 4. Got it, students?
Yes, sir.
Yes, sir.
Okay. So based on this, these are the points that we'll need to remember about the mucopolysaccharidosis. So if it is heparan sulfate which is impaired degradation is taking place, it will lead to mental deterioration. Okay, so which mucopolysaccharide is associated with mental deterioration? It will be heparan sulfate. Okay, and dermatan sulfate, keratin sulfate, all of them, chondroitin sulfate, are associated with mesenchymal abnormalities. If it is asked to you what is associated, which of following is not associated with mesenchymal abnormalities, DS, CS, KS and HS, then we can easily choose HS as answer. Okay. Only condition which is X-linked, which one is it? In inheritance,
Type 2.
it is Hunter's disease. We had seen here. This Hunter's disease is X-linked. Okay. The most common mucopolysaccharidosis, which one is most common? So Sanfilippo. Sanfilippo is which type?
Type 3. Type 3.
Type 3 is most common, followed by Hunter and Hurler. So most common is 3, then 2, and then 1. Clinically, which is found more common. Okay. In which condition you will see no mental retardation? So shy disease, which is type 1S. Okay. Morquio disease is type
4.
4, and Merotex Lemmy disease is type
6.
6. So type 1s, which I have not mentioned here, type 1s, which was due to dimethyl sulfate. So type 1s, type 4, and type
6.
6. Alright. So if you see this first point, heparan sulfate is associated with mental retardation. Mental retardation. So if you see this, type 1s, type 4, or type 6, none of them has HS involvement. Are you getting it? So whenever there is HS, it will have mental deterioration. But wherever the HS is not involved, it will not be having mental deterioration. So type 1H, that is Hurler condition, has mental retardation. Hunter's has mental retardation. The type 3, it has mental retardation. And type 7 has mental retardation, but not these three types. Type 2, type 4, and type 6. So it is asked to you, which is not associated with mental retardation, it would be heparan sulfate. Is it clear, everyone?
Yes, sir.
Yes. Yes.
Okay.
Yes, sir.
In which condition you will not see corneal clouding or this uh, yes, MPS with no corneal clouding. Which two conditions did not have corneal clouding? The Hunter and Sanfilippo, type 2 and type 3. Okay, you can, how you can remember between type 1 and type 2? No, type 1 and type 2 is almost same except for the corneal clouding. Type 1 and type 2 are same except for the corneal clouding. So as you had remembered, multiple things we had remembered for Hunter, no? That is, name T is there, which is for type 2. T is there, so sulfate is. So one more thing you can remember just for the sake of remembering is, a hunter has to look well. His eyes should be clear. Then only he'll be able to hunt more. So that way you can remember that corneal clouding is not there in hunter. So in type 1 and type 2, if you compare, it is everything is same except for the corneal clouding. And other condition which does not have corneal clouding is type 3. So type 2 and type 3 does not have corneal clouding. Okay. A condition of mucopolysaccharidosis which does not have visceromegaly, as I told you, the Morquio condition, the Morquio disease, it does not have visceromegaly. Visceromegaly means increase in the size of the organs, hepatomegaly, cardiomegaly, which is absent in the Morquio disease. And the same enzyme deficiency, which is associated with two diseases, which is Hurler disease and Scheid disease. Which type of disease are there? Number, if I could tell, Hurler disease is type
Type 1. 1.
and Scheid disease is type.
Type 1B.
Both are there. It is called as type 1H. It is called as type 1S. Okay. So if you see the types, no, one I have written as A and B, but let's just keep it type 1H and type 1S. So in multiple disease, there are multiple subtypes, 1H and 1S, type 3 A, B, C, D, type 4 A and B. They are there. All of them, this type 3 and type 4, they are divided into multiple types based on same group of symptoms but caused by different type of enzymes. Okay, but type 1H and S is same enzyme but depending on how much effect it is causing. If it is totally absent, it is Hurler syndrome. If it is somewhat present but causing lesser effect, having lesser quantity, showing somewhat mild effects, it is Scheid disease. So this is clear to all of you, these things about mucopolysaccharidosis that we covered.
Yes, sir.
Yes.
Sure, everyone?
Yes. Yes, sir.
Sir.
Dr. Preeni, is it clear to you? Preeni, can you hear me? Dr. Pranita, am I audible to you? Bhavna, can you hear me?
Yes, sir.
So all these things we just now discussed is clear to you?
Yes,
Kuldeep,
sir.
Yes, sir.
Takshi.
Yes, sir.
Yes.
Okay, I hope it is clear to all of you. So let's see few more things about. No issue, Dr. Printa. That's fine. Okay. Uh, yes, few more things about mucopolysaccharidosis, glycosaminoglycans that you see. These are points. If you want, you can make notes of it for the specific points that I'm telling you. The glucosaminoglycans, which does not have uronic acid, it will be keratan sulfate. Okay, this is also the keratan sulfate is also glycosaminoglycans, which is present in retina. So the glycosaminoglycans present in retina is keratan sulfate. Okay, glycosaminoglycans, which is anticoagulant, as I told you, is heparin. Glycosaminoglycans which does not have any sulfate group is hyaluronic acid. This hyaluronic acid is not linked covalently to protein hyaluronic acid. All right, the GAG found in bacteria is hyaluronic acid. So hyaluronic acid, these three things you should remember. The hyaluronic acid is one which does not have sulfate group. It is not linked covalently to protein, and it is found in bacteria. Okay. Then chondroitin sulfate, which is most abundant glycosaminoglycans. This can be asked to you, which is the most abundant glycosaminoglycans found in the body. It will be chondroitin sulfate. Where are these glycosaminoglycans formed? They are found in endoplasmic reticulums and in Golgi bodies. What is the shape of the proteoglycan monomer? It is bottle brush. Glycosaminoglycans, which is helpful in cell migration, is hyaluronic acid. So one more point about hyaluronic acid. What all 4 points was there? It is no sulfate group, no binding with protein covalently. It is found in bacteria. It is helpful in cell migration. Okay. The glycosaminoglycans which have role in compressibility of the cartilage and weight bearing areas are hyaluronic acid. So hyaluronic acid also is helpful in compressibility. Other thing is chondroitin sulfate. So chondroitin, the chondra word itself is for cartilage. So chondroitin sulfate is there in cartilage. Additionally, it is hyaluronic acid. The glycosaminoglycans which plays role in corneal transparency, as I told you, which is there in cornea. I said retina. It is cornea. It is keratan sulfate along with the dermatan sulfate, which this I already told, but which glycosaminoglycans, if absent, will lead to mental deficiency, mental retardation. Which enzyme was it? Just now we saw.
Heparin.
We just now saw here, na? The HS, whenever it is affected, it will lead to mental retardation. So it is heparin sulfate, which is associated with the mental retardation if it is absent. Okay, heparin sulfate is also the one which determines the permeability of the renal glomerular membrane of the kidney. Okay, so these are the some points that we need to remember. Acha, intracellular GAG, that is glycosaminoglycans, which is present within the cell. Now, if it is a mucopolysaccharidosis, in that case, the leukocytes will have different type of inclusion bodies in the form of glycosaminoglycans, except for one. Which condition does not have leukocyte inclusions? Which type?
Type 4.
Type 4.
The name is?
Okay.
Small key.
Okay, as we had seen here, the only type 4 or the Morquio condition did not have leukocyte inclusions. Except for them, all the condition have leukocyte inclusions. Okay, but in general, in cell which glycosaminoglycans are present, so heparin is present in mast cells, heparan sulfate is synaptic and other vesicles. Synaptic vesicles we all know, in the at the area of synapse where the nerve and muscle are in contact with each other, that synapse is there. Within them, there are vesicles, synaptic vesicles. In that, heparin sulfate is present, and the glycosaminoglycans present in heparin, it will be mast cell. So you'll be able to remember all these things. Even if you're not able to remember right now, make notes and try and revise whenever you're doing it next. So is it clear to all of you about the glycosaminoglycans?
Yes, sir.
Yes, sir.
Yes, sir.
Okay, so as I told you, glycosaminoglycans with no uronic acid, we just now saw, is keratan sulfate. With no sulfate group is hyaluronic acid, and not covalent link to the protein is hyaluronic acid. Is it clear, everyone? Shall we see some MCQs before we conclude?
Yes, sir.
Yes.
Okay. Mucopolysaccharid in mucopolysaccharidosis, which are lysosomal storage condition, it is due to abnormality of
Option A.
everyone.
Option A.
Hydrolysis. E. Hydrolysis enzyme.
Yes, it will be hydrolysis enzyme. Just hold on. Okay. Yes. So this correct answer is which enzyme?
Hydrolase enzyme.
Hydrolysis. Hydrolysis.
These are lysosomal hydrolase enzymes. Type 1, type 2, type 3, type 4, type 6. Type 4 has A and B, and type 7. Type 1 is due to which enzyme? Quickly.
Alpha. Alpha.
Iduronidase. Type 2 is
Iduronate sulfatase.
sulfatase. Type 3, you don't need to remember. There are 4 different types. Type 4A and B are there, 5 and 6. So type 4A and type
N-acetyl
6 are same. That is N-acetyl
galactosamine 6 sulfatase.
6 sulfatase, and type 6 as 4 sulfatase. Type 4B is beta galactosidase, and type 7 is beta glucuronidase. Okay, all of this are example of hydrolysis enzymes. Okay, a patient is coming to you with corneal opacification or corneal clouding that we saw with increased intercorneal distance and wide gonial angle. These are all features of macrognathia or coarse facial features just now we saw. The condition was diagnosed as Hurler syndrome. This is due to
Lysosomal storage disease.
it's not lysosomal storage disease. The condition is lysosomal hydrolase enzyme is not working properly. The Hurler syndrome happens due to glycosaminoglycans. It is the actual question should be glycosaminoglycans accumulation. This is question from NEET MDS 2024. But it is due to glycosaminoglycans. Remember this. All right. Is it clear, students?
Yes, sir.
Yes, sir.
Okay. Next. There is this 2-year-old child who has protuberant abdomen. That means she has visceromegaly because size of organs has increased. Coarse facial features, umbilical hernia. She has corneal clouding. She has mental retardation and she has short stature. What is the probable diagnosis? So let's see one by one. Okay. Corneal clouding. Corneal clouding is absent in which conditions?
Hunters and
In hunters, it is absent, and
sand.
but that is not there in option, right? So that we are excluding. Then mental retardation. Mental retardation is absent in which conditions?
Morgue.
We had seen that thing, no, where the heparan sulfate is not there.
Morgue. Type 4. Type
So
6.
Type 4, type
in
6.
Mortex-Lamy disease, mental retardation is not there. And in 1S, if you remember this, no, there are different types we saw. In type 1S, only DS was there. HS was not there.
Present.
So even in 1S, that is shy condition also, patient will not have. Hold on. In shy disease also, patient will not have mental retardation. So the only option that we are left with is
Hurler disease.
Hurler's disease.
Hurler's. Clear, everyone?
Yes.
Yes, sir.
Okay. There is a 4-year-old boy who has mental retardation, dysautosis multiplex, coarse facial features, but clear cornea. That is, corneal clouding is not there. Condition which does not have corneal clouding.
Hunter disease.
Hunter's disease. Sand.
Simple. Hunter's disease does not have corneal clouding. Which other feature, other condition does not have corneal clouding?
Sand.
Type 3. Alright. So, also we remember Hunter has to have clear eyes. So, clear cornea should be there. So, that is under Hunter's disease. Is it clear, all of you?
Yes, sir.
Yes, sir. Yes, sir.
Okay. The mucopolysaccharide that doesn't contain uronic acid.
Keratin sulfate.
Keratin sulfate.
Right? We just now saw here GAG with no uronic acid, it is keratin sulfate. Heparin is example of?
Glycosaminoglycan.
It is example of glycosamine. Glycosaminoglycan present in the cornea is?
Keratin sulfate.
It is keratin sulfate.
Keratin.
Okay. GAG associated with mental retardation is?
Heparin sulfate.
Heparin sulfate.
Heparin sulfate. Okay. All right. Yes. So that's all for our today's topic. Was it clear to all of you?
Yes, sir. Yes, sir.
Okay. So in this NEET MDS 2024, that is just a year before, one question